So we just wrapped up our second quarter of naturopathic medical school, and I wanted to shed a little light on what the experience has been like so far, especially as someone with a business background and a non-science background. I figured that my experience might be insightful for others considering if this is a path that could be right for them. And I would say that if you have the passion, a strong why, and solid self-discipline, that almost anyone of any background can achieve at least what I have so far, which is survive the first half year. So, we'll see if I can make it all the way through the program. So far, it's going very well, and I feel very good about it. But, knock on wood. And yeah, we'll just stick with the first 6 months because that's what I can talk on so far. And so diving right in, the first quarter was basically anatomy, physiology, biochemistry, a history of naturopathic medicine course, and a integrative case study course. And then there's going to be labs for anatomy and physiology. And there is also a clinical practice course too, which is where you're going to start learning hands-on skills that you would use in a clinic with patients, such as taking vitals, using tools like stethoscope, sphygmometer, and so on and so forth. So that was what Q1 looked like. The cadaver lab for anatomy was super cool because you're in dead bodies, essentially, learning hands-on all of the different muscles, the attachments, origins, insertions, innervations, what those muscles do, and the bones, ligaments, tendons, you name it. It's super comprehensive. And so I want to share all of that because it is a very legitimate education that you're getting in terms of the foundation of sciences and the human body. My brother is in DO school, not far from me. He started the same time that I did, and so I talk with him and compare what they're learning versus what we're learning, and it's essentially the same. So if you are someone who is skeptical about the field of naturopathic medicine and the education, just know that it's the same foundational sciences as the other types of medical programs that exist in the US at least. So, and then for people who are considering this field and maybe don't want that type of education, then maybe it's not for you. Down the road, we obviously learn tons of Chinese medicine, botanicals, regenerative medicine, physical medicine, you name it. So nutrition, but yeah, tons of things. So that's all there, but that is layered on top of that strong foundation of rigorous sciences, basically. And so with that said, it requires rigorous studying. And so that first quarter, you have to kind of just adjust to the lifestyle of studying and accept that you're going to be studying a lot. And really that first quarter, I didn't think it was that much. You still got most of your weekends and nights to relax, unless there was an exam maybe on that Monday or Tuesday. Then you would put in a little more work on the weekend. But if you're someone who wanted to, go out or do things on the weekend, you absolutely could have that first quarter. I took advantage of it for sure. So yeah, it's a pretty good school life balance at first. And then this past quarter, I would say things ramped up a little bit more for sure. And so the other aspect here is if you're someone who wants to really master the material and, get A's in your classes and do well, because, my school, Sonoran University in Tempe, Arizona, we use the, GPA scale. So it's not pass fail. However, there are plenty of people who are completely fine with just passing the courses, because to not get set back in the program, all you have to do is pass the courses, which requires a 70 or higher. So there are people who really just care about passing, and then there are people like me who maybe a little more type A are really trying to excel to their highest capabilities. It's probably a little imposter syndrome from having a business background still there. But yeah, it's kind of just a matter of who you are. And I would say that if you are someone who's just concerned with passing, it's really not hard to have a pretty good life balance. I would say if you are that person though, you know, might ask yourself, like, why are you really here? Do you have that deep degree of passion and intrinsic want to really learn everything you're learning? It's just something to consider, because it's a marathon, not a sprint, is, you know, what everyone that I've talked to who is much further in the program than me at least says, and I already feel that, and I'm only a half a year in. So that's just what I would consider there. But, you know, overall, I think it's very doable if you just have the passion and drive to do so. And you can have a life, you can have relationships. There's plenty of people who are at different stages of life. We have a few moms in our class who are, you know, some of them are doing the 4-year track, some are doing the 5-year. That's the other thing that's unique about naturopathic medical school, is you have that option for a 4-year, 5-year track. So if you are someone who wants to work while going through school, or has kids, or just a busy life, and you know, you just want to do it in a more relaxed way, the 5-year track is there. I'm doing the 4-year. A lot of people start on the 4-year, and actually about 75% move back to the 5-year track by the time graduation occurs. So either leave the program or get, you know, kicked back for whatever reason. So that is, I think, another testament to just how rigorous the schooling is, and how common the misconception that it's not, you know, a true medical school. And because of that, you know, you have people who might not have what it takes to go the full distance, or the passion, really. So I don't want to, you know, speculate in any reason why that number is as high as it is. The number of people who start the 4-year track and don't complete in 4 years, or complete the program at large. You know, that can happen from failing a course, failing a milestone, like a board exam, or a voluntary reason. So it is just something to consider, though. It's intense schooling. I've been told it only gets more intense. I love the grind, so I think that helps a lot. If you're someone who enjoys the grind and the work, and just being able to learn, you know, all of the incredible, fascinating things about the human body, you're in the right place. But if not, you know, hopefully this at least gives you enough information to consider to see if this is a program and path that you'd like to pursue. I definitely am not wavering. After my first half year, I am more committed now than starting, and I'm pleasantly surprised by the rigor of the courses and what we're learning, and just honestly how good the professors are too. With maybe an exception or two, but overall it's really good education. It's hard work, but it's worth it. So far, I would say, for sure. So yeah, I hope, you know, you found this video useful. If you're someone who wanted to learn more about what is naturopathic medicine and the schooling for it, I'm going to try and continue to document my journey as a student, and ultimately as a physician down the road, just so people can really understand what, you know, the field of naturopathic medicine entails, which a theme is going to be the fact that I don't like that term, honestly, because it is not all encompassing, I feel, of everything that I'm going to be learning and doing. We're doing, you know, our education is far beyond just naturopathic remedies. I mean, we get the education in pharmacology. We're able to prescribe medications. We're able to do minor surgeries and procedures. We learn all of the bodily examinations and tests that you would run with patients in a clinic. And then on top of that, of course, we learn things like acupuncture, botanical medicine, homeopathy, physical medicine, naturopathic manipulations, regenerative medicine, you know, peptides, stem cells, like the list goes on and on. So precision testing, functional medicine, muscle testing, like, again, the list goes on and on. So like, I personally think this is the future of medicine. It seems, to me, as someone who's been a professional patient for most of my life, which is a big part of why I'm doing this now, is because I've seen the shortcomings in care, and I've also seen the shortcomings of care in the conventional medical system or medical industrial complex, and I've seen the power of alternative medicine in various capacities. I mean, the stuff just works. And like, yeah, there's going to be quacks out there who peddle, misinformation or things that don't work. That's going to be rampant in every industry. It's no different than in conventional medicine, where doctors use, off-label medications that, there's no randomized control trials to the robust level of things like that are naturopathic, things like curcumin, or echinacea. So it's just like, we're trending this way. People are waking up to the body's ability to heal naturally, and synergistically with other more conventional approaches. But like, ultimately, again, our schooling, it's not like us versus them. It's a blend. It's the best of Western medicine and the best of Eastern medicine. So that's what I want people to understand too. And so that's just my perspective. It's my own opinion. Obviously, none of this is medical advice or advice for your life, but hopefully you found the information I've shared useful and helpful if you're trying to make a decision one way or the other for if you want to become a naturopathic doctor. Thanks again for watching. Peace.